Good afternoon, ladies and gentlemen. My name's Dennis Gilhooly, and it's a real pleasure to be back here this year. We did the digital health session last year. This year, we've had some very, very fertile sessions before this one on data as a global public good and artificial intelligence. And it's quite clear that within the last 12 months, the agenda has moved very rapidly on the global stage. That being said, within the context of the political declaration from the General Assembly just 1 month ago in New York on universal health coverage, the language used and the movement in terms of accelerating action in the digital health space was not very encouraging and really didn't move forward on concrete commitments. That would be the same, really, in terms of the G20, which was pushing on digital innovation very much this year and aging populations, but did not really move the agenda forward. So in 2020, which is only 10 years from the Sustainable Development Goal deadline and the UHC deadline, we really have to start accelerating progress. With that, I'm going to ask each of the panelists for a brief introduction of themselves and their organization and where they fit in the global evolving ecosystem for digital health, which includes so many things, from AI through to mobile communications. And we'll drill into the digital transformation elements, where we are today, the actual ecosystem which is evolving, particularly in terms of data governance, the missing links, and then the way ahead, where we're actually going to look for transformational change in moving forward. So with that, I'm going to hand over to Francesca Colombo on my left. Francesca.
Thank you very much, Dennis, and it's a pleasure really to be here. So I'm the head of the health division at OECD, which is the Organization for Economic Cooperation and Development. So for those of you who do not know what is OECD, it's an intergovernmental organization gathering 36 mainly high-income, but also some middle-income countries, which has as motto, better policies for better life. So essentially, we do support governments in improving their policies in all the different sectors, be it the environment, the macroeconomic, the education sectors, and health as well. So we really try to help countries try to really transform their health system so that become much more centered around the needs of people, which is really the missing issue. And where do I fit in the discussion on digital? Of course, digital is a possibly important enabler for transformations, but I guess the big question is, why is health so much lagging behind other sectors of the economy? And it's about a decade lagging behind in really leveraging not just digital technologies, but also data, which are really the lifeblood of digital systems, to make a benefit to really improve the lives of citizens and obviously contribute to the economy. So why is health lagging behind?
Good afternoon. My name is Bernard Hamlin. I work currently in Sanofi, and I'm in charge of the global evidence generation team. This team focuses on outcomes, patient-reported outcomes, clinical outcomes, outcomes that matters both for payers, physicians, and patients. Why is this outcome so important today in the industry? Is primarily because we have great opportunities thanks to availability of large set of data, high quality of curated data, data coming from a diverse source of information, and also the possibility to analyze them. The platforms, the analytics available today allows us to make important insights coming from this data. Now, a data-driven decision-making is really important to limit the bias. We tend all to come with looking at the data with our culture. The way of analyzing the data is really influenced by our background, whereas when you look at different methods, unsupervised, looking at what data tells us, you start to see things that you couldn't see before. Now, these data and the analysis of these data are critical, first to accelerate the research, so we can identify small segment of patients, new drivers for transformation. Also, we are looking at how we can use this data to accelerate access to treatment by accelerating the documentation of our programs. There's a lot of work doing on transforming the clinical research using database, much more than the traditional clinical research program. And finally, it's customer experience. How do you understand patient behaviors? How do you measure at point of care, in between point of care, how people are behaving when they're receiving a treatment, and you observe the outcomes? These are new information that helps us to better manage the condition we want to support. Thanks.
So I'm Marie-Josée Hébert. I'm Vice President Research at Université de Montréal. I believe I'm here to represent the perspective of academia. And so I'll present in a few brushstrokes what is University of Montreal. It's one of the largest French-speaking universities in the world. We have a hotbed of activities in the field of life sciences with medicine, veterinary medicine, dentistry, pharmacy, nursing, and so forth. But we also have a track record of excellence in the field of computer science, and more specifically in deep learning. You probably are aware that Yoshua Bengio was professor at Université de Montréal, was awarded the Turing Prize of Computer Sciences in 2018 for the discovery of deep learning. And so this really translated in the Montreal ecosystem into massive investments in the field of artificial intelligence, with $1 billion and more within the last 3 years, changing the face of the economy in Montreal. And as academia, having been part of this major transformation, we really wanted to make sure that we were contributing positively to the transformation of the ecosystem, not only in the field of health and healthcare, but also in the field of health and healthcare because of our areas of excellence in life sciences. So 2 examples that I would give, and I would like to echo the previous comments on patient-reported outcomes, and more broadly, having the capacity to welcome and embed the patient perspective within this new learning health system. So 2 initiatives. First, we've created the Montreal Digital Health Consortium, and that speaks to the necessity to have governance structures that are multi-stakeholder, that really welcome around the same table academia, industry, government organizations, and patients and the public to tackle challenges in a way from policy to legal framework to ethics, in a way that will be positive and conducive to positive innovation. The second element was another of our initiatives was the Montreal Declaration for Socially Responsible AI. And just rapidly, story of how this evolved. So this was a forum that we launched, welcoming in Montreal scientists from obviously computer science, but also law, bioethics, sociology, anthropology from around the world, and having them work on a set of values that could guide us for the ethical development of AI application. But we actually then reasoned that this was missing a key component, and this was the voice and the experience of the public. And after that, we organized a series of town halls within the province, throughout Canada, and also in Europe, to get the sense and the preoccupations of the public. And this really enriched the dialogue and the discussion, so that in December 2019, we could launch a declaration that provides 10 guidelines, 10 principles to guide us on the best way to not only think about, but apply AI technology to various sectors, including health.
Thank you.
Thank you. My name is Bernard Mariano. I'm the Chief Information Officer and Director for Digital Health and Innovation at World Health Organization. At the World Health Organization, one of our key targets, which is enshrined in our global program of work for the next 4 years, it's to achieve what we call a triple billion target. This triple billion target is connected to the SDGs 3, which is really health for all and health and well-being for all. within this triple billion target at the World Health Organization, we want to make sure that within the next 4 years, 1 billion more people enjoy universal health coverage. We want to make sure that 1 billion more people are better protected from health emergencies. We want to make sure that 1 billion more people enjoy better health and well-being. So that's what is enshrined in our global program of work, and that's what drives both the department that I'm leading, the Department of Digital Health, but also all the other teams at the WHO. So we want, talking about the Department of Digital Health and Innovation, we want to make sure that, first of all, the global digital health strategy, which is currently undergoing reviews by member states, went through public consultation. We want to make sure that by next year, World Health Assembly in May, it gets approved by our member states. And that global digital health strategy has 4 strategic objectives. The first one is really to ensure global collaboration, which is promote this global collaboration and the knowledge. And the second one is advanced implementation of national digital health strategy as part of the national health strategy, just to make sure that we use digital health to accelerate those achievement of the triple billion, but also achievement of SDG 3. The fourth one is really to strengthen governance. There on the governance, I wanted to just maybe talk a little bit more about it. So in today's situation, I think Francesca said we are a couple of years behind. One of our member states told me that WHO is 15 years behind on digital health. I think the whole healthcare ecosystem transformation into a digital age, it's behind for obvious reasons. We talk about health, we talk about lives at stake, so perhaps there's a bit more conservative in terms of how do we move there. But as we go through that transformation, we want to make sure that this governance gap and the trust gap is addressed. And to ensure that as citizens of the world, when they engage or use those digital health technologies, they use it knowing that the data is secure, there's ethical consideration, there is no harm that will come to them because of the usage of these technologies, and it's secure, safe, and it's accessible to all. And the last objective in the strategy is basically to ensure that it is people-centric. So at WHO, we've been working so far and a lot with the policymakers, with the academia, with the ministers of health, with the practitioners. And yet, the tech giants are going straight to the consumer, meaning that within WHO, we also need to ensure that we go through that digital transformation inside WHO to deliver products and services that also address the consumer needs, the people's needs, to avoid situations such as the one we had recently where measles reappeared in the US because of the anti-vaccine movement, because the platforms have inaccurate information. Perhaps somebody can say because WHO is missing in that platform. So that's really, in a nutshell, to not take too much time, what the Digital Health and Innovation Department is all about.
I'm Peter Albitz. I'm the country manager of Pfizer in Germany. Pfizer is a global company based in New York and represented in most countries of the world. We live in fascinating times. I'm a biologist from background, and when I look at what's happening right now, the pace of change and innovation, this is fascinating. I think what we see is a convergence of biology and digital technology, which now drives, and I think we can see it, unprecedented progress in terms of breakthrough medicines, life-saving therapies, and maybe we are just at the start, of an even stronger development of that. Now, this fits perfectly to what our purpose is. Pfizer's purpose is develop breakthroughs that change patients' lives. So talking about digitalization, this is where we need to get deep into, in this convergence and really understand it. We talked a bit before, tech was not at the front, 10, 20 years ago when you talk to research, but now, it starts to get at heart and core, of how you build your research strength and develop it. But that's just, one area. I think what we're seeing is a complete transformation of health. Also in other aspects in terms of our value chain, we see the manufacturing, the way, we'll work on developing IoT-alike models in manufacturing. But, it all has a means to an end, which is serve the people and the patients. And, on that aspect, I think the consideration is important. What does that mean for people and patients? Now, you ask people around the world, what's the most important thing in their life? Across all countries, 80% would say it's health. And yet we know, of course, in developing countries, significantly shortfalls against what people would expect at basic health care coverage, but also in developed markets. And to that question of, we see quite a slow development of digital innovation into healthcare. You addressed the points, what are reasons of that? I think health is, as we say, a very sensitive topic. The other one is health is, and health ecosystems are complex. It's not easy just to find one lever and drive the innovation. And healthcare systems are complex, so it needs all carefulness. So maybe there is something good about not being so fast. I would like to see it fast as well, but this is something we need to explore really carefully, and we need to understand what is really at the end the impact this could have to patients and patients' lives and health outcomes. And if we look at healthcare systems today, I think we cannot say they're really patient-centered or outcome-centered. So that's a big opportunity in the digital age to create this kind of, how to say disruption, but kind of disruption needed and transformation towards systems which really serve this purpose of being patient-centered and health outcomes-focused.
Thank you, Peter. That's excellent. Well, where are we today? A parallel session next to us right now. The title is Health is a Political Decision. Well, digital health is even more of a political decision, a geopolitical decision, which crosses so many boundaries. The dichotomies from legacy to leapfrog systems, from the public to the private sector, from the health to the finance community, and from the pharmaceutical to the ICT communities. These all remain siloed and need to move into an evolving ecosystem. But the state sort of where we are today is that we're really entering an era of Star Wars science against a background of Flintstone age health delivery. So there has to be a fundamental shift. But make no mistake, universal health coverage or the health-related SDGs are unachievable by the 2030 deadline without the strategic and innovative use of information and communications technology as it relates to digital health. So, Francesca, the OECD is in fact the Sherpa for the G20. And there was progress this year with the first ever joint meeting of health and finance ministers. The two real gaps are the inclusion of the private sector and private sector investment and innovation, but also how we actually pay for innovation moving forward. How would you add to that comment?
Oh, that's a big issue. So how do we pay for innovation? I mean, for sure, if we're talking about digital, we cannot talk about digital just, I'm thinking about that's a public sector issue. So the private sector must be part of the conversations, partly because some of the digital solutions obviously come from that. But also when we look what are the issues, the stakes, really the health of the population that needs to leverage upon the contributions of all the different sectors. Now, if I think where health is really struggling in this conversation of really bridging across different sectors, bridging across different stakeholders, in perhaps in having the in a way, the investment and the capacity that other sectors have been able to do, in really having a better governance, which really help to move things forward, and also having a strategy really to move forward. So if we take, for example, the issues of investments and capacity, I mean, I was looking at some of the data preparing here for this session, and we see that investments that has gone into health and into health data and digital health, it's about 1/4 of what has been the investment in other sectors when we talk about data and digital solutions. And that investment is not just in terms of... It's not 1 in 4. I cannot give you the 1 in 4. So it's like it's lagging behind in terms of the investment. And it's not just investment in the hardware, if you want, but it's really investment in that capacity, which has to do also with human resource capacity, the actors, the health professionals, all the different stakeholders into the field, really having more digital even literacy, if you want. So that is something which is, again, like health not really catching up with what is happening in other sectors of the economy. So that's one obvious issues where there is something that can be done, and where the contributions of the public and the private sector is a fundamental one. The other issues obviously are about governance. You mentioned the issues of governance. There are actually already principles of good governance of health data. The OECD countries have agreed upon what is called a council recommendation on data governance, health data governance. It took about 3 years to get to these agreements. These are high-level principles about what are the key ingredients which are needed to have privacy-respectful use of data to support public goals, ranging from research to better disease surveillance, to system management and so forth, all the different public goals that you have. So we have those principles, and we're monitoring the progress the countries are doing across OECD, which unfortunately is very slow, and we can discuss why that is very slow. And lastly, I think we need strategies. And so if we look again like where countries are, a lot of OECD countries, for example, now have some sorts of legislation in place about making sure that can have and can use and leverage data for those public health purposes. But do they have really a comprehensive strategy? And is this strategy part of a wider, perhaps like economy strategy, which involves all the different stakeholders? Well, not yet. I mean, much fewer countries really have comprehensive strategies to address it. So these are just some reflections.
Bernardo, building on the point that Francesca just made, these national digital health strategies, which are essential, have to be embodied really in the national digital economy strategy, otherwise they will be irrelevant. And where do you see the role of national champions, both in terms of leading governments, whether that's in LDC, least developed countries, or in the industrialized countries? What cooperation could you see between the two? And where do you see national champions coming from the private sector? And then I'll lead on to our two private sector representatives to ask them on the role of the private sector in accelerating this revolution.
Thank you for this complicated question.
Me first. No, I have a mic. Thank you. But you can go first. Well, normally private sector is quite advanced, so it shows that very fast. I think the digital leadership, it's very key to succeed at national level. I think we have some example of some countries, Estonia in Europe or Rwanda in Africa, where the leadership plays a key role to really advance the digital transformation across, not just on health sector, but also in other sector, which really brings that change culture. It relies on partnerships, and then there is a financing component that allow this to evolve and really ripe those benefits of digital technologies to advance development, but to advance healthcare in the health sector. Francesca mentioned strategy and governance. While we can think nationally, using national borders or the geographical national concept that we have in our physical world, as we go digital, those concepts get blurred because there's no a national border for a digital service. You buy from Amazon regardless where you are. I mean, if you have the connectivity and the Amazon is able to deliver, so you get that delivery. And healthcare sector, if we want, for instance, the telemedicine to bring the health diagnosis to remote areas, be it in high-income countries such as Australia or a low-income country such as Mozambique. I'm from Mozambique, so I can talk about my country without offending anyone. We need policies that allow that to both the health insurance system, the doctors to be remunerated for those kind of interventions, to make sure that a community, a remote community in Australia or a remote community in Mozambique, they can reap those benefits of, for instance, access specialized treatment faster to make sure that life is saved. To give you an example, if somebody has hepatitis C living in a remote area, how long does it take for that patient to see a specialist in developed countries? It might take too long in some countries. So how can telemedicine help that to shorten that time between the diagnosis and being able to see a patient, let alone the costs of transport and commuting to move to the small remote village to a specialized center. Now, how can we make sure that on the image side, the AI, especially for the AI-supported device, how can we make sure that in remote areas where there are no labs and no lab specialists, so those diseases can be diagnosed early enough? So at WHO, we want to, as we go through that approval of the global strategy on digital health, we want also to ensure that we work together with the different partners to really take these as a challenge for us to deliver what we promised to ourselves in the Sustainable Development Goal, to ensure that the implementation of the strategies can deliver that sustainable impact on people's health and well-being, in ensure that the countries can prioritize on digital health investments. Because we have a pilotite problem. There are too many pilots around, and some of them fail. And many countries try and implementing something that is very advanced, but they need the basics to be there. They need electronic health records. They need electronic medical record systems. And yet they want to implement something that without it doesn't work. So we want to, as we go through that approval and implementation of the strategy, to support countries that are in different stages of the digital health journey to reap those benefits. Digital health is to accelerate the gains, the health gains we want to accelerate, be it on vaccine, be it on disease, and HIV or malaria, tuberculosis, or just aging. I hope I answered your question.
Yes, we'll come back. I'll get on to the...
Now you can go.
Yeah, okay. Bernardo, sorry. Bernard and then Peter. On the role of the private sector.
So it's easier to come back after the response for part of the questions. I would tend to agree and not completely agree. If you look at the private sector, you can see that in parts of the world, particularly in developed countries, you will see the industry driving the transformation through the innovation they bring. So the tech sector, the GAFA and other large tech companies are now moving into the healthcare to really transform the healthcare using the local data to be able to transform how the practice is done. And some success is observing in how this is used. On the contrary, I would say in other countries, you will see that it's still a slower process because it's very much attached to government approach and regulations that limits the pace of the transformation and the innovation. If you look at the industry, we are highly dependent on an ecosystem. We can't operate without the data coming from the healthcare sector, quality data curated, allowing us to run our modeling and simulation. We need, of course, to work closely with the academic world to be able to understand where the science is going. And of course, now the tech sector becomes really important. As was said previously, it's a combination of the biological advances and the digital advances that are going to make the innovation for tomorrow. And I think the transformation we see currently happening in the healthcare sector is going to come from this convergence of science, computer science and biological science, driving the innovation in a very rapid way.
Peter?
Yeah, may just complement, the has been addressed. I think when you look at the advancements in terms of medicines and diagnostics in the digital age, it all comes from our ability, to capture and access large databases and use the AI-based analytics and algorithms. So, that's important to understand that, this is the source. Yet when you look at healthcare systems today, in the different parts, it's not integrated. I mean, when we look at kind of research in cancer, in the US, 3% of the patients and their data are used for advancements in research, which is the clinical trials, but 97% are not today. So, the role we can play and will do is support those initiatives. There's one in the US, it's called Cancer Link, Cancer Learning Intelligence Network for Quality, which brings together, connects all those sectors, right? So that you can also access, all the data which are distributed, in physician practices and hospitals and universities. And that's what they've done. The ASCO, American Society of Clinical Oncologists, have led that initiative. We've been part of it for quite some time, SAP as well. And that creates a digital ecosystem of data, which allows us to understand much better diseases and then develop the according diagnostics and therapies. So that's a role we can play, connect players, connect sectors, and work with them. But not also on that level, it's also the question, how can people just get immediate access and benefit from the potential which the digital age brings? And this is, creating platforms where people can quickly get an assessment and a better understanding of their disease. There is a startup called Ada Health, which started in Berlin, now spread out in many countries of the world, and they use AI-based algorithms to bring kind of understanding of several diseases to patients and help them to navigate through their disease and follow up. We work with them, bringing in our knowledge on, for example, rare disease. What are the patterns? How can you detect them better? So that's something we brought in so that they can further develop these kind of platforms and give people their benefits. And maybe to the example, Bernardo, you raised from access to healthcare in remote countries where it's not been placed. I mean, we are of course also active in developing countries and supporting initiatives, NGOs over there, and also startups. So one project which we have just started to support is Zipline in Ghana, where they use drones to bring in medicines to remote areas. And this, I think, is just showing how technology can help to overcome those barriers and hurdles. They will supply about 150 essential medicines to, I think, 2,500 healthcare delivery places, and then covering maybe 15 million people over there. I think with using those technologies in a smart way, we can make a significant difference quite immediately in terms of access to health and medicines.
A follow-up question. What about the sort of private sector paradox in terms of the pharma community? Because you're increasingly asked to innovate, and as I say, I'll come on to the inefficiency of clinical trials later, but you're also under forensic scrutiny on drug pricing constantly. And we have the opioid crisis, for example, in the United States right now. I'm not talking about Pfizer or Sanofi, but there are some bad guys in the room. And this is really quite serious, I mean, in terms of the way the public perceives the pharma industry? And then what about a rebalancing between shareholder and stakeholder value? And how would that rebalancing of that valuation mean for the life science industry and for innovation and access?
Well, big questions, right? I mean, to the one aspect, I mean, this is a crisis, you know, where we need to put all efforts on to you know, get out of this crisis. And as you said, you know, there's been really bad guys, and they need to get, you know, punished and take their accountability, you know, as everyone has to do, you know, when they don't play by the rules. I think that's a very clear point, and the industry is very clear about that one. The other one, I think that's, you exactly described, the dilemma, or the question, how to move into the future. Now, I mean, a couple of years ago, we had a lot of talk about Me Too medicines and prices of Me Too medicines. I think some of this discussion might happening, but now we talk much more about these are breakthrough medicines coming more and more. We really see big advancements while they cost price, because one aspect also happens, they become more personalized, which means higher efficacy, lower side effects, smaller samples. And as you say, you know, this creates a challenge because your investment, you know, into, you know, those areas goes up. What's the solution? No easy one, but I think there is a pathway into the future where we need to balance those needs, because we need to have sustainable funding. No discussion, you know, otherwise this won't work. I think we need to rethink the way and question we look at innovation and how we incentivize and pay for innovation. And that is true, I think, for everybody. That's true for us, and that's a tough road to go into. Today, healthcare systems pay for inputs. And in a way, you know, that kind of, it's a payment, you know, if systems are very sick, you know, a lot of money goes into those systems. That's the thing we need to change. We need to change healthcare systems towards a health outcomes system, a system which incentivizes for outcomes. And that, you know, I believe needs to apply for everyone who is part of it, part of the game. And I think also for us, it's a big transformation and transition. I think we need to paint go the way very carefully, step by step, not rush, but really understand how do we measure, you know, what's the right evidence parameters we need to look at, how can we build the ecosystems and the prerequisites that this can really be thoroughly done and creates the outcome we want to have and the patient impact we want to have. But that's, I think, where we can bring it together, right? So bring the innovation into the systems and also ensure that societies have a sustainable way to fund what they see as their priority and need.
Thank you, yeah. And that's a good segue to Marie-José. You're a physician, a kidney specialist, I believe, and also an academic. What is the role, the critical role of academia and universities moving forward in the ecosystem? And how do you see the evolution of, with AI, for example, of the patient-doctor relationship? Is it just the gift of time in ameliorating administrative costs, or is it more?
Well, as alluded to, and I fully agree with what you just mentioned, I think that we are looking for a major transformation, not only of the ecosystem or the health system, but also we really have to be proactive in transforming the way we train both the life science specialists and the computer scientists. And one of the reasons why we are lagging behind in the field of life science compared to autonomous vehicle, mobility, or energy type transition is probably the fact that our computer scientists and engineers are trained in silo from the life science schools, whether medicine, pharmacies, public health. So at the very start of pre-grad training, they seldom have interactions. And so it's a lot more difficult to create this common language when you don't have a set of, you know, common experiences. And so this is certainly something that we are looking into rapidly modernizing. We don't have time. We certainly are entering an acceleration phase with regards to digital transformation in the healthcare system and the healthcare and the life sciences. And so we are looking at a number of training, transformation phases of our training programs so that our life science specialists will gain some basic knowledge into computer science from pre-grad. And we also are going to develop what we call interface scientist programs. So people that may come from the computer science track record, but at master's and PhD program, then start having experiences within either the healthcare system or the industry field in such a way that they understand the culture, the scientific culture, but also the specific challenges that are associated with the healthcare field. And we don't have a decade in front of us. You know, if we do not do these changes rapidly, and I'm speaking about in the coming years, we will be lagging behind, and we will not be able to foresee, you know, some of the disruptive technology that will be already part of the everyday life of our health care professionals. So, and lastly, I think that we really need to make sure that not only we're very often talking about life science and computer science, but we need also to have the legal experts, the policymakers being part of the conversation, and when we're training these individuals, I think that they need to be open to understanding, you know, why this isn't important, that they are part of an emerging and evolving ecosystem, and that the way that they are doing provision of healthcare now is going to be changing in a very dramatic way. Lastly, continuing education. And so training and retraining, we are certainly enhancing our capacity to talk to the various cadres of healthcare professionals so that they can get acquainted with the many challenges and the many transformation steps that are, you know, happening in real life in the system now.
Thanks. I want to move on to expand on digital transformation. We're currently moving from system one thinking, which it's been coined, which is reflexive, to system thinking two, which is reflective, and from treatment to prevention, as we know, and the pandemic and NCDs. On the other side, just the other day, Google announced its quantum chip dealing with massive data, which diminishes processing times from supposedly 10,000 years to 200 seconds, but it hasn't totally been proved yet. But Francesca, and for the rest of the panel, where do you think the key digital enablers for digital transformation are going to be in the next few years? Is it advanced analytics, orchestrated technology in the ecosystem, dynamic data, or domain expertise? And also, where do you think data and digital is going to be most impactful? In the chronic disease area, in pandemic control, if we have another massive flu epidemic, for example, or in personal-centric precision medicine? So it was a big...
So yes, it's quite a lot. Okay, a very first thing, of course, where you need, in a way, to invest. I mean, you need to have the data, which are really the lifeblood, but they need to be of certain quality, they need to be accessible, and they need to be used. And so this is a very, very first starting point. If we look at, across OECD countries, this is not really quite the case yet. The data might be there, but they're not really of the quality that can be then leveraged upon to generate all of those, public goods and goods utilizations that you're saying. So that's very first thing, you need to do something about the data in a way that they are good quality. Timeliness, for example, of the data. I mean, very, very few countries in the most advanced economies, we're talking about some of the Nordic countries and Korea, that really are able to leverage all the data which are contained in electronic medical records to have real-time use of that data, and most of the others are lagging behind. I think there's Estonia and Denmark are they're able to do that for about 50% of their data sets. The others are really lagging behind. So obviously you need to do something about the access, the quality, the timeliness, and the use of the data to start with. That's the very first point. Secondly, it's like, where do you see the possible uses of the data? There, I mean, a lot of that. A way to frame and think about how the digital and digital data in health can be transformative in health. It's perhaps at 5 different levels. The very first one is obviously clinical optimization. So there is a lot of talks about really trying to be much more precise about identifying the specific risk profiles of different population groups and trying to tailor the type of health services and treatments and so forth to that specific needs. That requires really having all the data coming from all sorts of different data sets that we have across the health systems, which are often in electronic medical records, but they are not linked in a systematic way, to really understand and stratify the health needs of population. That's the very first thing, clinical optimization, so what we are doing. Secondly, there is an issue of surveillance. You can bring all this data together in a way that allows you to survey much better, both issues such as public health pandemics and so forth, but also to survey in real life what are certain of the technologies, digital technologies, assistive technologies and devices, what's the results really of those? And very few countries are doing. There is a program, I think, called Sentinel in the United States that really looks ex post from those devices, what is happening. So surveillance is this second issue. The third one, which is not really done, it's really the system governance. So can we really address that about 20% of health spending, which is wasteful, that's a publication we did some time ago where we estimated the extent of health data, of health investment does not deliver any results, to eliminate duplications, to eliminate medical errors and all the other clinical ways that happen. That can be done through leveraging these linked data sets. And there are obviously issues that you can do about research, and that's another, again, big area. It's like bring together the data in a way that allows you to bring us forward in all the different clinical areas in which we need that better research. And the last one is obviously empowerment of individuals. Give them the data so that they can know about their own health, they can interact with the health system better. And all the most advanced economies now are in the, making good progress in giving individuals access to their own clinical records. But very, 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 very few, and we're talking about perhaps 2 to 3 countries, allow some interactivity in that discourse between the patients and their clinical records so that they can even put in more information in and so forth. And I think that is the other aspect. So all of them are all important. Research is important, surveillance is important, clinical optimization, all of that are important. But I'll stop there, yeah.
Sorry. What do you think will really bend the curve on cost? Because clearly, with the NCD pandemic, health costs are spiraling out of control. The average in most OECD countries is 10% of GDP spent on healthcare. It's nearly or over 20% in the United States, which is for different reasons. The vested interests of the insurance companies and some of the pharma companies. But are real cost savings going to be made on the clinical trials, for example, where there's enormous wastage in terms of the development of one pill? It can be $500 million, for example. Or is it in the focus more on more prevalent diseases like diabetes as the increase in prevalence, or should we be just concentrating on cancer, for example? These are big questions, of course, but Bernard and perhaps Peter on that one.
Peter?
Oh. Bernard, we're getting... Bernard,
you decide.
You first.
Okay. So cost is a concern. It's clearly something we are looking carefully because the cost and the complexity of clinical trials is continuously rising. There's no doubt that doing clinical trials at more than 500 million makes little sense over time, and particularly since we have now, I think, using real-world evidence, a much better way to capture outcomes that are really relevant for the different constituent bodies approving drugs, but also payers and, of course, clinicians that are managing the patients. I think the way digital health is now impacting the clinical research, many components of this clinical research is going to be transformed using the tools, the identification of sites, the identification of patients, the ability to connect the data capture with the EMR. There are many aspects that will be automated. But fundamentally, I think it's going to be doing much more relevant trials. The design of the trial using the right endpoint will be important. And I think here we have the opportunity to design endpoints that are much closer to the practice, involving endpoints that are probably not yet completely validated, but we need to contribute to validate. I will mention, for instance, the voice, understanding when the Parkinson, at what stage you are listening to the voice of the patients, or depression, and voice can really detect very early symptoms. And all these new endpoints coming from the digital use of information will help us to go quicker to the documentation, and will help us to reduce the cost of the development of the products.
Maybe just building on that aspect, I think, when we would navigate all towards, this health outcomes and value-based system, this will also come with efficiency. And, just to cover out, what are elements of it? I mean, clearly preventative interventions, are key to that, right? So that very early on, we will be able to prevent that people become sick, and that's, I think, a big area where we can create relief also on cost side. Predictive, so the better we become in predicting, potential outbreaks or progressions of diseases, and the earlier we can tackle them. I mean, look at the incredible cost of chronic diseases and the chronification of many, be it cardiovascular, be it pain, and others. That's another huge and significant area. And the last one, which I laid out before, is precision and personalized medicine, where we just increase significantly, the effectiveness of the treatment, and thus also the efficacy and efficiency. So these are just three of those elements, and I think they all play big into better outcomes, higher value, and lower cost.
Yeah, Marie-José and Bernardo, how do you prioritize? In Kenya, for example, there's now a national renal dialysis program, but that's competing for funds dramatically with primary health care. The same in Rwanda, for example, where there's now a national cancer program, but it's much more expensive than the cost of primary health care. What advice do you give to national governments in how they can reconcile these competing objectives, which are in fact complementary, of course?
Yeah, so to answer this question, I guess I'll go back to your previous question, because I see the low-hanging fruit with regards to what will be the most positive, relatively rapid implication of digital health as the capacity to increase efficiency from diagnostics to access to treatment. And we have the capacity now to actually automate a lot of these various steps so that increased efficiency could actually quite rapidly reduce cost. However, we also need to make sure that in doing so, we will be able to capture the algorithmic errors, because they will at some point be mistaken. They will probably not make the same mistakes that we physicians are making. However, we've grown accustomed to physician-based errors, but the patients, families, public do not necessarily, and that's the same for autonomous vehicles, do not have the same relationship with an error that comes from an algorithm, and there are questions of responsibility. So it means that if we want to be able to really focus on those low-hanging fruits, we have to make sure that the governance structure and the relationship with the public is done in a way that we do not jeopardize trust in the system, and that there are human beings taking decisions, and that we have an embedded system where we can actually diagnose mistakes, errors that will be coming from the algorithms and learning from them. And I guess that with regards to priority, I'll be, looking forward to your thoughts on that. But But there are, ethical issues, and certainly in the field of transplantation, we go through either an utilitarian or more personal, specific way of allocating organs. And that depends on the conversation you have with your community globally, within the country, with values and culture. So it does mean having these dialogues before, going through something that may look like an arbitrary decision. So again, making sure that it's not only top to bottom, but that we are having a multi-stakeholder conversation to evaluating what are the priorities, how do we move forward, how do we reach a consensus to move forward, and how do we reassess if this consensus is still present.
Absolutely. Bernardo, we're in this moment of breakthrough innovation, breakneck speed, but we do need a functioning payment system. Answer the priority question, but a functioning payment system and also a regulatory system, particularly in the area of electronic health records, where there is so much dissymmetry within the system today. How does WHO advise on these dilemmas?
Thank you. I think, maybe I would like to take a poll, if you allow me, to the audience, talking about tech giants versus life science industry. Who believe that the tech giants will purchase the life science industry? Please raise your hand.
So 20%.
Which is a reality that is happening, right? We might have a situation where the tech giants are purchasing the life science industry.
And the pharma.
And the pharma.
Yeah.
And yet, I think from the regulatory perspective, the life science are used to the regulations that we, both from the norm and standard perspective at WHO, but also the governments at national level, they ensure that the clinical trials and everything, do no harm and it happens. So we are in this space where the merger of these two need a good regulation that does not stifle innovation, but does not also create a chaotic situation with no regulation. So I think that's the balance that we need to play. At least at WHO, we believe that's what we believe is central to our role to try to strike and help government to strike that balance. And we need a conversation such as this one, where we have academia, private sector, and the public sector. So we need to do that, to ensure that we really take the best out of all of us, understanding our different priorities, profit making and impact on the public health or the research agenda. It's all addressed. So one of the areas is perhaps, some sort of a bill of rights on health data, or some sort of a research collaborative agenda for AI. How can we, as entities, work together to deliver those frameworks to ensure that we do no harm, we ensure that the patients, the benefits to the patient and people is immediate. I think to your previous question about priorities, if you ask my mother whether she should prioritize her liver, her lung, or her heart, of course everything is important. Health and well-being is not about one organ. It's about the whole, a person. So as we use digital health to accelerate universal health coverage, but also quality of health care, and ensure that we don't have people running out of money because of health expenses in many of the developed countries, because there are 100 million people per year that go into poverty because of out-of-pocket expenses related to health. So it is our collective role and responsibility to make sure that the transformation delivers lower cost, delivers quality health care, and accessibility to everyone. I hope that answered the question.
A follow-up question, because there is the danger, I think it was mentioned in the last session on data as a public good, of the emergence of oligopolies or monopolies in the data world. We do need to work with the tech giants, but that doesn't necessarily exclude the ITU or the World Intellectual Property Organization, does it? Do you see a change in mindset right now in terms of a multi-stakeholder ecosystem that we can actually move towards?
I think we might need to really rethink how do we approach this, our beliefs, rules, and procedures that we very much used to in the physical ecosystem into the digital ecosystem. One of them is intellectual property. I mean, with the role, how do we define intellectual property in the physical ecosystem? Does it need to be the same in a digital ecosystem? Perhaps not. And the other is what I mentioned before, geographical coverage. I mean, do we take that into digital ecosystem? Perhaps not. And how do we ensure, as we have new diseases that are appearing, such as the gaming disorder in the digital ecosystem, where do we treat it? Where do we make sure that the change of behavior to keep people out of hospitals, where does it take place? Does it take place in the physical ecosystem, or we work in the digital ecosystem to ensure that the change of behavior to keep people out of hospitals, to ensure that as we go digital, the do no harm really impacts on people's health? How can we do that? So striking the right balance is key. So the hope is that in groups like these and other forums, and as we bring together private sector, public sector, and academia, we have a technical advisory group for digital health that we're bringing those sectors together to really advise us on how, what, and what priorities we should have to drive both the WHO digital transformation, but also to support countries in their national digital transformation.
Thank you, Marie-José. And then I'll go to the floor for Q&A and allow as much interactive time as possible.
I do agree, but I wanted to echo what you were saying around the multi-stakeholder governance structure, but the fact that I certainly believe that we need a multi-stakeholder structure, but all stakeholders need to understand that it's not same old, that they have to sit around the table accepting that there's a new mindset, a new collective mindset that needs to be developing, and that things that we've taken for granted within our own scientific cultures have to be questioned, and have to be questioned collectively. And if this does not happen, then we will have a seemingly multi-stakeholder structure that functions in silo, and that will bring only chaos.
Agreed. Any other comments before I go to the floor? No. Okay. Is there a roving mic? Is there a microphone? There's a question here right in the front. Yeah. If you could state your affiliation.
Yes, my name is Roger Simard. I'm with HPVawareness.org and a clinical pharmacist who's been practicing using digital health in the last 5 years. And one of the major problems we face with using, for instance, connected devices, electronic dashboard, AI, is that our healthcare systems do not have interoperability. We don't have transactional systems. We have systems when we can make a deposit of information, but we can't access it. The patients certainly don't have access in most of the times. And so we're creating all this data, and this data cannot go anywhere. We're using telemedicine sometimes in the private systems, creating another file that doesn't communicate with, or data that doesn't communicate, is not transferred to your file. And in the LMIC countries, I hope we're not going to do what we did in our countries, imposing systems that are not interoperable. What do you see? How do we get to the point where this interoperability becomes almost a law, where if you develop an EHR, you have to have interoperability. If you have already an EHR on the market, maybe you have 2 years to make it interoperable, and do what Ukraine has done, do what Estonia has done, and once and for all have universal possibility to transfer data and empower patients with their own data.
Yeah, a standardization interoperability question. Any takers?
I think it's an excellent question, and some of the tech giants are already working on it, and I think our technical advisory group, we also took that as one of the key areas. The many member states, they have, I mean, I don't think there are very few countries that do not have challenges on interoperability of health systems, health information system. So there is the HL7 or HL7 FHIR API. So I think from the previous generation of health information systems to the next generation of health information systems, we have an opportunity now to actually work on that interoperability to allow legacy systems and the future systems to interoperate. I was at, I visited Apple 2 weeks ago, and they are already interoperating with the health information systems, hospital information systems through the health app that they have in their devices, and basically patients can just get the prescription, but using the FHIR API as an interoperability between different private providers of health information systems. So we need, as a community, to come together to define those standards, because that will give the opportunity and give the patient or the individual the power to have that. As WHO, we also need to perhaps bring that interoperability in vaccine. We have our famous yellow vaccine card that maybe should go digital. I kept telling my colleagues that it's time to have a digital version of that, and to ensure that today's generation, 20 years from now, they will have their digital records available to them with the trust and governance and ethical framework that allow these to not be misused, but to generate those benefits that they need to generate.
Thank you, Bernardo. And I think it's fair to say that one of the ironies of the lagging nature of the health industry, maybe a decade, maybe 2, actually, I'd say, is that we now have the opportunity to look at the abuses of the likes of Facebook in terms of trust and any type of trusted ecosystem, and build in the safeguards from the very earliest opportunity now. And that is an opportunity we cannot disregard, because it's absolutely essential. Francesca.
Yeah, I just wanted to add, because, we all agree that there is lack of interoperability. There are 2 observations, perhaps. First one, I think low middle-income countries have an opportunity, what we sometimes say is to skip generations. High-income countries came first and before in using digital data in developing electronic medical records, and they have systems which are very not interoperable in many countries. If you are a country which starts from scratch, perhaps you have an opportunity already to build it from the start, something which is more interoperable. So perhaps opportunities there. Second question is, who should drive this agenda about interoperability? And I think it's open, for discussions. There could be even some sorts of voluntary agreements across different public and private sector actors as well. As it has happened in some other industries where there were protocols that were, developed, not necessarily led by one public, government, but really more by the private sector realizing that unless we have that, we're not going to get the benefits out of it. Or should there be an impetus more coming from the public sector and from, broader global organizations, international organizations, to try really to bridge their agenda. But it's still open. It's still open, and it's a big issue, because even if we solve all the data governance issues, which are huge, about the privacy, respectful use of data, and all the other elements of a good data governance, we're still then left with the very practical data which might not be talking to each other. So, must be addressed. How to drive this? I think it's still a little bit open for questions, and there are roles for different actors. Yeah.
Anyone else? Oh, there's another question in the middle.
Yeah, hi, I'm Doreen Rosenstrauch, Dr. Doro Institute, also University of Maryland, and I want your thoughts on an international medical license for physicians and also maybe nurses. And I'm telling you why I'm asking. So with the burnout and also the physician shortage, which is worldwide, we're practicing telemedicine for quite some time now. And we are in dire need of physicians, and not physicians only, also nurses. And we also always encounter to actually get them the license that they can practice in those countries, right? So we have compact agreements in Europe, right? But then in the US, you have to get relicensed again. So what we need is from the world to agree on a standardized curriculum maybe, and that those physicians and nurses go through that, and they have a license to practice telemedicine all over the world, from wherever they are. And then a cherry on the cake would be a malpractice insurance valid internationally as well. So what are your thoughts on that? Where we are, can we make that happen? Thank you.
So I do agree with your suggestion that we certainly need to strive for more international collaboration in the way that we train, and also developing training programs that will be accessible and applicable to the greater ensemble. We have to recognize, though, that telemedicine or the conditions of remote indigenous populations, for example, in Canada, versus Australia versus Africa, can be quite different and challenging. And so I suspect that for that, we probably need a two-layer approach where we would need to have a fully accredited program providing the fundamentals. And after that, programs that tailor to the needs of the community you are going to be working with, making sure that you have the knowledge, the know-how, both from a life science but also cultural capacity to evaluate, so work with the technology, but also assess whether you're meeting the outcomes that are your objectives. And currently we don't have, such a global system. We have point of cares, we have bits and pieces, but we're lacking this integrated vision. And it does, again, speak to how do we build an ecosystem? How are we cognizant of the various pieces that are missing so that we're not, building, going piecemeal from, one part to the other, but how do we build this fully integrated learning system vision?
There's a question up the top.
Yeah, yeah, thank you. Danny Sheath from the Institute of Global Health at the University of Geneva. A lot of my research focuses on digital health and also climate change. And I've been in a number of sessions over the last 3 days, both looking at climate change on one side and sustainability, and also digital health and big data challenges. I just wondered, what do you see as a green future for digital health? We have a huge bad legacy of outdated digital technologies in a lot of countries, and we also know that the tech industry is one huge contributor as well to greenhouse gas emissions. So, yeah, how do we make digital health sustainable?
Well, actually, yesterday we had a conversation with the Global Health Group, and we were discussing that digital and global should actually have a sustained, lively dialogue, because many of the challenges that is being faced within the global health, One Health framework could actually benefit from innovation that is to come from digital health. Obviously, digital health does not come without a cost, and some of that cost is compute power and is energy dependent, but that may actually be taken into consideration in moving forward and establishing what are the pros and cons and where does the balance tip towards more pros than cons. But I think that if we silo the two conversations, global versus digital, we are going to miss a great opportunity.
Well, digital is global and global is digital, though.
Exactly.
So, yeah.
Exactly.
Quickly.
Yeah, just quicker, but I completely agree, but I think it needs to be even casted broader because there is a fundamental issues of the environmental footprint of the health systems, which is the digital, but think about hospitals, you know, with lots of things which happen into hospitals and which are not necessarily environmental friendly, and how do we deal with the waste and so forth. So I think there is much, you know, different type of things that needs to be addressed. One is how do we encourage perhaps different lifestyles which are which are good for the health, but they're also good for the environment. But secondly, how do we measure and try to address the environmental footprint of health systems? And I think that's somehow missing, and it needs to be brought more on the agenda.
And in fact, some of the work we've been doing in the Caribbean and in the Pacific Island states, which are facing, on the one hand, a pandemic and chronic disease with diabetes and hypertension. On the other hand, they're facing catastrophic climate change difficulties, and working directly with the mobile companies there to bridge the gap between the direct health impacts on the ground and disaster recovery. Was there a question in the middle, I think, sir?
Hi, thank you very much for such a lovely discussion. My name is Dr. Hirsch. I'm a medical practitioner from India and the policy researcher at Public Policy Research Center in New Delhi. My question is for Bernard, and it has three parts.
Bernard or Bernardo?
Huh?
Bernard and Bernardo.
Bernard from WHO.
That's Bernardo. Okay.
Bernard. I'm so sorry.
It's okay.
The panel mentioned that LMICs have unique opportunity to leapfrog. However, this unique opportunity to leapfrog would come by making the right policy decisions. And so my question has three parts. One part is medical colleges do not have a digital section, and doctors do not have exposure to digital tools right from their training. And this is part number one. Part number two is certain laws in countries like India, they do not inculcate telemedicine practices. For example, a primary care physician cannot directly consult a patient, but he can consult a specialist and seek opinion of a specialist. Part number three, there is a cost involved in adopting digital systems. And in countries like India, when expense on healthcare is around 4.7% of GDP, out of which only there is 1.3% contribution by the government, I want to ask whether WHO is working on those policy framework with the government of India or other countries in this regard for adoption of digital health, or to adopt a common framework so that data interoperability can be a reality.
Thank you. Let me maybe start by also commenting on the question about the international medical license for telemedicine. WHO is opening a WHO Academy. That you just gave me a good idea to make sure that that course, or that certification, it's included in the new WHO Academy, which we plan to inaugurate it, I think, in the next 2 years, 2023. But the courses will start in a digital learning platform next year. And the aim is to reach 10 million people in the next 3 years in terms of training and literacy for the healthcare practitioners. So that's one area. On the LMIC and to leapfrog, I think you just mentioned something that Marie-Josée did allude to in terms of changing the curriculum, in terms of making sure that the digital and life science or medicine, it's somehow we bring the students at the early stage in that particular area. Because I met students, I met a medical student who finished medicine and was starting computer science, actually from India. And because that was the only way for him to be able to master both. And that you shouldn't have, we should actually embed some of the digital health in the medical schools. And currently, it's maybe few hours or days that a medical doctor has the digital health or computer science equivalent courses within the curriculum. I think what you mentioned about, laws and the cost, this is all part of this ecosystem. You cannot think about digital health without looking at the full ecosystem, even the change process. I think Francesca mentioned when answering about the green future of digital health. It is a change of mindset, and there's a change of habit, and a change of the status quo, and there's a change of the practices that we have been doing until now that will really allow us to navigate and go through this journey without killing the environment, without killing the world, without creating more global warming. But at the country level, at the national level, we do work with the governments, and India is one of them that we have a very large program on digital health with the Indian government, and a number of other partners have as well. The challenge of national government is how to prioritize and how to navigate the different interests by NGOs, by private sector, by anybody who comes in and talks about a drone delivery or this cool tool that countries have to invest, and then suddenly they cannot sustain, or maybe they needed a basic system to sustain that, the electronic health record, for instance, to be able to sustain whatever advances that we have. So the advances of digital health can be undone by country laws. I mean, even Canada says now that Canadian data cannot leave Canada national borders, right? It has to be stored in Canada. And how can you then have an ecosystem based on artificial intelligence that leverage on data that is sitting in Canada to make a decision for a diagnosis when Canada says that data cannot be in the cloud? I mean, so those are the conversations that we need to have, the decisions that we need to make, that at the national level, at the global level, laws, policies, and regulation are there to leverage or to create an environment of that innovation can flourish, but also to protect the citizens, to ensure that the ethical and privacy is respected. So it is, from WHO perspective, these work to both work with developed countries to make sure digital health reduce the cost of healthcare and increase addresses issues on some of the rare diseases and others, but also allowing the least developed countries to leapfrog, as Francesca said, to ensure that the right investment is and the right prioritization is implemented to really get the advantages and the benefits of a digital technology. So we are working with India. India is one of our, I would say, countries from the developing world, or middle-income countries that is way more advanced than the other BRICS or middle-income countries on digital health. So we are very happy to share more and more details, the experience we have in India.
Two quick questions, and then I'm going to ask for summing up from our panelists.
Okay, my question is very quick. My name is Tessa Lennemann. I'm from GIZ in Germany. And I think you mentioned that there's like all these different competing trends to motivate countries to establish different apps, and there's a lot of pressure, and it's important to prioritize for the countries. So I think what has worked quite well in the past in a different area was the WHO pre-qualification of drugs or of tests. So can you imagine that WHO could pre-qualify electronic goods or public goods to sort of like help the countries in prioritizing and putting together a mix of governmental, whatever, public tools or digital tools that they could then use?
Yes, you just said what we are working on. Certainly, that is one key area. We have, there are two products we have in WHO, in addition to others, the guidelines, but we have the essential list of medicines and vaccines. We need a corresponding digital, essential list of digital health tools. We have the pre-qualifications of medicines and vaccine. We need the equivalent for on the digital the ecosystem as well. So we are working on that specific area. There is a challenge, and not only for WHO, but also for the regulators, the FDAs. It takes 150 days for WHO to pre-qualify medicine and vaccine. When you move into AI, 150 days is maybe 20 upgrades of the system will take place. So how can we equip ourselves to be able to respond to that fast pace of certification or assessment of those tools? And we need to work together on that. But yes, we are working on that. That is an area that we need to fast track and bring it to the place. The Minister of Health of Mozambique, who is my childhood friend, he told me that lots of companies, NGOs went to her, and one of them said, let's develop a drone delivery system in Mozambique. And she said, I need a motorbike and a cooler because I need to reach out. I mean, I don't need a drone because I cannot maintain. So those are the type of prioritizations that we need to advise our member states, again, countries. And also, she told me that she uses WHO essential list of medicine and vaccine when she's pushed and pressured to buy something that somebody says it's going to resolve a health issue. And they say, look, go to WHO, make sure it's there, and then I can talk to you. So it's not just about having it there, but also it's a way to protect the ministries of health from entering or having the pressure, political or otherwise, to go into projects that might not deliver that health outcome.
Yeah. One last, I think there was a question. One last question then. Sorry.
Hello, thank you for this wonderful presentation. For me, this was a new field as well, digital health. I'm a clinician from India and an international health specialist who's living in Berlin now. My question was, since we do not accept different qualifications, medical qualifications from different countries, and we can't agree on a standardization to practice, will the data collected from these different countries or regions which vary variously culturally and also in the diversity of diseases, will we be able to compare those the data collected from these countries and use them in other regions? And the second one is, if something goes wrong, who's held accountable?
Okay, this is a very good point in terms of regional difference. I think, Bernard, you had something to say on this. Regulations in China compared to India. In Germany, data privacy, for example, is entirely different from in the rest of Europe.
Yeah, so regulation is different in different parts of the world, and the ability for us to use data of respecting the local law to be able to help. But beyond the regulation currently that is limiting the use in some cases, there are enough data available today from different sources to be able to conduct the research and the type of improvement on the healthcare that is required in different parts of the world. So even if, for instance, in Germany, we can only use German data in Germany for German patients, we still have the possibility to advance quite a lot already in Germany with the data to be able to improve some of the systems we're using. As long as we have the trust of the patients, and that there is a good understanding of what is the impact and the purpose of what we're doing with these data.
Thank you. Could I ask the panelists to sum up in 30, 60 seconds maximum their takeaways from this very rich discussion? And I hope that we've summarized the state of play in digital health and the potential way forward. Peter?
Yes, I enjoyed the discussion a lot. Maybe, takeaways, looking to the future, what would I see as the right development? One, from today's fragmented healthcare system into tomorrow's integrated health ecosystems would be one. From input-based, incentivized systems to outcome and health outcomes-based systems, and from cost-centered systems to patient-centered systems. That, I think, would be the navigator for the future.
Very good.
I think there's a lot to be done, both at the individual level and both in the agencies, and but also on the literacy side. I think we spoke. I mean, I did enjoy the fact that we did touch up on that area quite greatly, because normally it's an area that it's not. I mean, there's not enough attention given to it. So I think I was very happy to see that, because we need to really reap the benefit. That area it's key, and I think the need for us to collaborate, a true collaboration, as Marie-Josée said, it's important, and that makes all of us responsible to make sure that this sector, the healthcare sector, goes through a very successful transition to a digital. You can see the other areas such as the banking or the media sector or even the retail, how they went to this, how their journey, digital transformation journey took place, and there are lots to be learned from there. And then how can really we even being a latecomer, how can we take the lessons from those sectors that have gone through to make sure that we do better? So I hope that this conversation and such conversations such as this one will allow us to really take this transformation into the next stage in a way that 10 years from now, when we reach 2030, we are all proud of ourselves. Thank you.
Not much to agree to what you to add to what you just said. I fully agree. I think that, however, we've been dreaming about digital health and digital literacy for a number of years, if not decades. It really is happening now, and in a very accelerated fashion. So we need to make sure that not only do we prepare, but that we are ready to start running, and that we are ready to start running together, passing the relay in a way that's fluid, and in a way that where we will be accepting to change the rules of the game as we go, based on outcomes, based on data, based on reassessment of what we're doing collectively together.
In this transformation of the healthcare through digital, what is going to be, there are many aspects that will change. Practice, the way healthcare is delivered, the way we will design new innovation. But one thing that I think is going to be dramatically improving the system is the role of patients. The patient will have a much more interactive role with the healthcare giver. They will have a stronger voice on their preference, in their choice. They will have endpoints that are more relevant for what is important to them. So I think we will have a system that will be improving a lot by taking care of what matters the most for patients in the near future.
So I said at the very beginning, the health is lagging about 10 years behind other sectors. So I think I would like to say it's time now to move health into the 21st century. I think that would be my first issues. As part of that conversation, it's clear that we need much more consultations broadly with citizens, with patients, with society at large. I mean, we are preaching to the converted. I don't think we all disagree. But there are a lot of difficult issues, technical, but also ethical and broader, which do require much broader discussions so that we can then have that transformation to have much more people-centered health system. But that's what I would say that needs to be done.
Thank you. All right, but thank you all for your questions. The inventor of the internet was on the BBC this morning. He's actually a colleague, Dr. Vinton Cerf, and he was talking about how the internet was broken and has to be fixed right now. We should be moving from the internet of things to the internet of people, which I think in terms of healthcare is really this change of mindset which now has to come across the industry and the sectors in terms of moving forward. Could I get a round of applause for the audience, please? I mean, for the speakers. The next session at 4 p.m. is on the Global Action Plan, which is basically fairly historic cooperation between all of the UN agencies and funding agencies to come towards consensus and collaboration in accelerating the Sustainable Development Goals. So much recommended. Thank you so much for your patience and attention.